Marhaba, ahlan, hello everyone, Khush Amadid. We welcome you to our webinar on importance of dental care and hygiene in early years. Thank you for joining us this afternoon. It is so good to see you all today. Before we proceed, we would like to highlight an important announcement to ensure that we respect this platform at all times. We ask you to kindly adhere to the Code of Conduct. We request all of you to refrain from taking any screenshots or video recordings. Taking pictures and recording without permission is prohibited by law, and sharing them on social media and elsewhere is a criminal offense. We would like to request you to keep yourself on mute during the session so that there is no noise interference. However, you will have the opportunity to ask questions and interact with our guest speaker. If we may request you to use the Zoom chat to type in your questions, and we will answer them during our question and answer segment towards the end. Parents, we request you to rename your Zoom names to your first and last name. If you are joining us together as family, then please write the name of family members joining. I will give you all 30 seconds to do so. Thank you, parents and family. Previously, in each session, we have been addressing the need for practicing healthy habits and routine and nourishment for our body. We have learned and performed activities about eating healthy food, following healthy behavior, such as exercising our body and keeping our mind active, sleeping on time, keeping our body clean, and praying. All these mentioned are very important for our children's physical and mental health. It helps them to stay active, work hard, and grow healthy. In today's webinar, we will continue looking at importance of healthy habits. Today, we will understand importance of dental hygiene and its impact on the rest of the lives of young children. We will also learn how to introduce children to good dental care routine as soon as possible. Parents, we will be translating the important points from the session in Arabic on the Zoom chat. I would now like to invite our esteemed guest speaker for today's webinar, Dr. Anila. She has received her BDS MCLIN Dent Pediatric Dentistry from UK. After completing her bachelor's degree, Dr. Anila specialized in pediatric dentistry from Queen Mary's Dental School, University of London. She also obtained an advanced clinical program in pediatric dentistry and is a member of both the European Academy and International Academy of Pediatric Dentistry. Dr. Anila has trained in behavioral science to understand child psychology, and she specializes in modern procedures with a special focus on conscious sedation. Dr. Anila is experienced in treating patients who are medically compromised and children with special needs. She has published many papers in reputed journals, including the International Journal of Pediatric Dentistry. It is a pleasure to have her amongst us today. Welcome, and thank you for joining us this afternoon, Dr. Anila.
Thank you so much, Sarah, for such a warm welcome and an introduction. Thank you. Hello, everybody. A warm welcome to you all. As you all know that we will be talking about the importance of dental care and hygiene in the early years today. But before, when we think about the dental care and hygiene, the first and the far more important thing that we need to understand is, what is a tooth structure? What is it all about? What is teething all about? Because until and unless we don't understand the basic concept of teething and the tooth structure, we wouldn't understand why exactly is it important and how to maintain it or care for them, right? So saying that, as the first slide shows right over here, is talking about baby teething. So what I'm going to talk about here is how it starts, what are the signs that a child may face through, and how can we do some home remedies in order to relieve them. So first of all, before I move forwards with that, I would like to give you a little idea about roughly between the ages of 0 to 3 years is when a baby tends to get his baby teeth starts coming through. And around the ages of 3 years, they tend to complete the entire set of baby teeth, which are around 20 in number. So normally there are 10 on the top and 10 in the bottom. So this is what it is. But one thing that we need to bear in mind is every child is different. It varies from child to child in terms of when and how the teeth come through. And secondly, what we need to bear in mind is that the teething may also vary from a girl to a boy. So a child is different. They have a different genetic inheritance pattern. So whatever they acquire from their parents, they have a different pattern that comes through. And secondly, girls are usually a bit more earlier compared to a boy. So a bracket of 0 to 3 years is what exactly we need to bear in mind to have a complete set of 20 baby teeth. All right, now as you can see this, the chart right over here on the screen. So it says that what happens is between the ages of 6 to 16 months is when a child will pop out with 2 baby teeth. And it is true that a child may start teething earlier as well. As I said, everybody has a different genetic inherited pattern. So a child may start as early as 3 months as well, which is completely true and absolutely normal for that particular child as per their age and growth and development. But it is also true that a child may not develop a certain set of teeth even after the first birthday. And why is that so again? Every child is different. Their hereditary patterns are different. So saying that, if I tell you the first 2 teeth that we need to expect that will appear are the first 2 bottom teeth, which are known as incisors, and they would come anywhere between 6 and 16 months. And then after that, between 6 and 16 months, you're going to get 8 incisors coming through. So 4 in the bottom and 4 on the top. Followed by that, you're going to have your first molars coming through. So after you've got the 8 teeth in the front, you're going to have your first molars coming through, which is going to come in the span of 13 to 19 months. Now, these are the teeth which are very difficult in coming out because they're quite big and bulky in nature. And secondly, the gum pads around those areas are quite thick at that time. So the piercing through at that time becomes very, very challenging, and it may be a very difficult journey with lots of meltdowns for some children. But so for some children, if the skin is thin, it would be a smooth sail. But we need to understand that these are the teeth when they start coming through. The practical approach of having it in terms of getting a lot of pain is very, very true. Followed by that, you're going to get your canines coming through, which is going to be in the span of 17 to 13 months, which is just going to be after these teeth, which are your actual piercing teeth like these ones. Now, canines, again, are the most difficult teeth to pierce through because they are very long in nature. They take a long time to come through. The super longest root they carry, and again the bulky nature, which causes the piercing much more difficult, and a child may have a lot of irritability, a lot of red inflammation around the area. So particularly between the span of 13 months to the span of 23 months, where you get your first molars up till your canines, are the most challenging months where the child undergoes. And then comes your second molars, which are your last set of the 4 molars, which may come anywhere between 23 to 33 months. So as I said, for some children, it is true by 2.5, they'll complete, and some would complete by the time they're 3 years of age. So what are the common signs and symptoms that we normally see is, we see that a child may be drooling. You see a lot of saliva drooling around the area. You see their skin flushing. You're going to see pink skin all around the area, heat flushes coming through. You're going to find irritability in the ears. You might find a child pulling their ears non-stop. The child may be very uncomfortable. The appetite may go down. You may see frequent coughing episodes coming through. They might want to bite, and they might want to just chew onto everything they may get and have a little relief. Now, if so, one thing that we need to remember at this point is that children may also land up into having a low-grade fever or diarrhea. Now see, diarrhea and low-grade fever is not something which would happen as an immediate result of teething. It would only happen is because the child is putting their hands here and there, and then it is going eventually in the mouth. So due to the cross-infection or the contamination, eventual cause is diarrhea and low-grade fever. And that is called a secondary infection of the gums, which is caused at that given point of time. So this is exactly what my child may go through, right, at that stage. Now, sometimes a question may occur in our mind, okay, either am I going to get all the teeth coming out in one go? Yeah, slowly, gradually. Again, I will keep repeating myself, every child is different. We should not compare them with their peers. Okay? So what we need to understand here is, it may take up to 4 days before the teeth starts cutting through the gums, and it may take up to 3 days after the tooth has cut through the gums for the irritability to eventually subside. So we need to understand that patience is the key. Meltdowns are going to happen, but we need to deal them likewise. So what are some of the remedies that we can see in order to relieve our little ones from the pain? Number one, a very good remedy that we can do at home is massaging their gums. Now, how should we massage their gums? Either we should take a gauze and we should refrigerate it, or put it in a freezer and make it go nice and cold. Then we should wrap it around our fingers with one finger and two fingers, and gently go around the gum pads of the child, massaging them gently and slowly. And that is something which is also going to give a relief to the child's gums. The second thing that you can do is, again, you can do a coconut oil, a cold pressed virgin coconut oil. You can do nice gum massaging around the area on the gums to give that little natural relief to their gums. So these are few things in terms of massaging that you can do. Number three, what you can do is sea salt and water, make a little paste with it and go rubbing the gums. Now what that is going to do is, we understand that sea salt has an antiseptic nature. So what it is going to do is, it is going to cut down the inflammation of the gums. It is going to thin the skin of the gums as well, and will allow a smooth sail of the teeth eruption. Thirdly, what we can do is, so children who are on formula milk or breast milk, you guys can actually try making some breast milk lollies or formula milk lollies, and you can let them suckle onto it. You can introduce a lot of hard breadsticks, carrot sticks, where they can chew on, they can like have a little suckling feeling, enjoy that feeling, keep them nice and cold so they enjoy that. You can do cold wooden sticks, and that could, spoons and stuff like that, that could help them soothe. There are a lot of teething biscuits available in the market as well, that could be actually put on a ribbon and put it in a child's hand, and the child can hold on to it and chew onto it as in how it requires. You can also use some brushes which are available in the market, which are actually teething brushes. I don't want to name any brands, but there are certain brands which have 0, 1, 2, and 3. So these brands have these soft brushes where you go chewing onto them, onto the gum pads, and the child may get that relief. So again, as I said, you can take a thread or a ribbon, put it around the wrist of the child. So you know what? Playfully, it will also encourage the child's proprioceptive activity, and they can also pick it up and they can chew onto it nicely and enjoy it as and when required. So there are a lot of things that you can do in order to relieve. Alongside, until and unless it is not required, don't go for Tylenols and Brufens. But if it is required, if the child is very uncomfortable, you can do that. You can do some homeopathy granules, rub them around the gums as well. You can even do grab waters in the night to self-soothe the gums. But anything which you can do more on the lines of home remedies would be awesome in order to prevent any issues or any secondary problems. Okay, now what another thing that we may come across is, how would my gums appear? I usually get this question in the clinic is that my child has this blood blue color sac inside the mouth and it looks really nasty. What is happening, doctor? So the first thing I tell them is, there's nothing to be worried about. Just like you can take this as an example, that just like a baby is protected inside a mother's womb in a solid sac with little fluid inside it, similarly, our tooth is also being protected by a sac of blood and fluid, which appears as red blue hue inside our gums And it is not true for every child. So it may happen to some children, and some children, the piercing may just happen with a general swelling on the gums. But if you see that kind of appearance, there's nothing to be worried about. Just like I spoke to you about the remedies that you can do at home, it is just protecting the tooth inside it. So your massaging, your remedies that we spoke about is something which will help relieve it, and eventually it will burst through. If it is getting very severe and the child is really irritable with it, and you can see blood oozing, or you can see the swelling quite evident with a huge blue blood sac, then obviously refer to your pediatric dentist for furthermore assistance required. All right. So as we see in this slide now, so as we've spoken about that, what are we expecting with the baby's teething and everything, we need to bear in mind what is the right time for them to lose the teeth. Because many of times I come across this question, it's a baby tooth, it will fall out. But we do not understand that why the care is so important for the baby teeth. Is because, yes, you're right, it will fall out. But we need to bear in mind, it is not falling out now. It's going to take its own course of time to fall out. So just like teething took 3 years to complete, similarly, it is going to take slowly 4 to 5 years for them to shed out, to be replaced by another set of permanent teeth, which we call as secondary dentition. So your baby teeth is also known as milk teeth, and your secondary teeth is also known as your permanent teeth. So now what happens is the first set of incisors that we got as early as between 13 and 19 months, so there's between 6 and 13 months, those are the teeth which are eventually going to start shedding off between the ages of 5 to 7 years for some children, or on an average of 6 to 8 years for some children. So we need to understand that these four will change into their respective permanent teeth between the ages of 6 and 8 years. So anybody losing it early is perfectly fine because they're active dentally. And if they're losing later, again, different genetic patterns and they're a bit delayed. But then one thing that we need to bear in mind is there could be some nutritional deficiencies which need to be looked into. For example, your calcium, your vitamins that need to be looked into and need to be balanced out for proper growth of your teeth coming through at their respective zone of time and growth. Okay, so now once the incisors come through between the ages of 6 and 8 years, the second thing that we need to bear in mind is that we've got teeth which are called canines, which are here, right? And these are your molars. Now these teeth are only going to change. So these are your canines and these are your molars. Now these teeth are only going to change in the span of 10 to 12 years. So we need to bear in mind, most of our children undergo cavities at the back teeth. And why? Because when they're chewing, when they're eating, the food is getting lodged there. I understand we all are brushing, but the thing is sometimes some kind of food particles are very harsh in nature. And we may not have the right dexterity of our hands to get them out. And henceforth, these teeth will take their own course of time. And if they get cavitated, then it's a long way to go before we lose them. So our children will suffer. That's why it is very important to understand that the back teeth from our canines to our molars are only going to change in the span of 10 to 12 years. Yes, it may be true for some children. Again, as I am repeating myself, it may be true for some children. They may change it earlier in the span of 9 to 10 years as well, but it is not true for most of them. So henceforth, it is very important to take care of those back teeth. Now, the last thing that I want to add to the second slide is, if you see this last molar, these are our first permanent molars. Now, whenever we're teething, whenever we're changing teeth, so this is more particular for the ages of 4 to 6 years to understand that whenever we're changing our teeth, as I said, from canine to our baby molars, they're not going anywhere until the ages of 11 years or 12 years. But then where is this tooth coming from? Is this changing any baby teeth? Is it pushing through any baby teeth and coming through? No. So what exactly is happening is that behind the 20 teeth, we've got a huge gum pad sitting over there. And what happens with that gum pad is, so that gum pad is empty. So when the time is right, when our child is just about 6 years or between the span of 6 and 7 years, this is when our first permanent molar tends to pop out. And again, you would see a certain level of swelling. You'll see the redness around the area. You'll see a bulge over there, which is absolutely normal. Again, what you need to do is take a brush, put a toothpaste there. I know there is no teeth there, which is perfectly fine. Go behind and massage that area with the brushing. And it is always nice to help your children with the brushing until the age of 8 years. By books, it is highly recommended that yes, make your child independent, but a supervised brushing or helping your child in the night brushing until the age of 8 years is perfectly fine and normal, because that is a little edge that they need in order to improve their skills for brushing and maintaining their hygiene. Right? So the first permanent molars will appear at the age of 6 years. So I'll just go through this slide quickly. We've practically talked about it. So some baby teething symptoms may include rash around the mouth areas, a lot of drooling of saliva, a constant irritability, a lot of meltdowns, trying to bite and suckle onto everything they get. A low appetite is absolutely normal, and trouble sleeping. But you need to remember to keep hydrating your child. Maybe take a pacifier. If your child is on a pacifier, you can even chill it up in the freezer and let them have a little comfort with it, or soothing it with anything cold like yogurt, ice lollies made out of milk or frozen yogurts. Okay, now as we've spoken in depth about the teething, one thing that we need to bear in mind is, what is a cavity? How does it appear? Now, before I speak about cavities, I'm going to show you something which is very important, and I feel which gets missed by most of us at most of the time. So this is a model that I have in my hand, which is talking about what exactly is a tooth and how many layers is there before the tooth touches the heart of the tooth. The cavity touches the heart of the tooth to actually cause our little ones that kind of discomfort and the excruciating pain that they have to go through. So look at this first. Can you see this area? It is very reddish pink in color. And can you see this area? This is light pink in color. So first of all, what you need to understand is this light pink is a healthy gum structure. And what you need to understand is the reddish pink skin is not healthy. It is an ill or a very weak gums. Now, this is my teeth. And if you see this white, hard, bony part, this is my enamel, which is the top part of the teeth, which is very important for the protection purpose, for the chewing and giving that hardness to our teeth. Now, if I go inside the tooth structure, so let's focus in this area. So if you can see, this is my enamel, okay? Now then you see this yellow part, which is my second part of the tooth, which is yellow in color, and it is known as dentine. And can you see right over here in the middle? This is the heart of the tooth, or the place which is the nerves of the teeth, from where it tends to get very tender and sore if a child gets into a cavity. So can you see this black right over here? There's a cavity which is developed on the enamel. But if it is ignored and not taken care, it will eventually lead into the second part of the tooth, which is our dentine. And that is where our child will start feeling. What will our child start feeling now? Our child will start feeling, Mama, I'm chewing my food, but मुझे थोड़ा सा दर्द हो रहा है, और वो मुझे ouchy हो रहा है, but that ouchy stays just for a flick of a second and it vanishes. या फिर हम brush कर लेते हैं, या if we do a little kulli, it will become better. Why? The food which is sticking in there is irritating the area because the sensations have started from here. As you can see, there are a lot of lines in there. That is the start of our nerve tubules. So that is giving that sensitivity coming through to anything cold, anything warm, or any food lodging in that area. Then what happens? हमने chocolate खाई, हमने कोई candy खाई, so eventually that is also something which is causing that sensitivity and pain. But we need to bear in mind why we as a parent tend to ignore this part is because वो थोड़ी देर के लिए pain आता है और वो थोड़ी देर के बाद subside कर जाता है. So थोड़ी देर is what? Literally 2 to 3 seconds of that sensitivity या pain and it subsides. ठीक है? So it doesn't stay for long. So we feel कि हाँ कुछ फंस गया होगा. It has come off. Nothing to be worried about. And that is how we tend to ignore it. So this is the pain symptom that is where our bells should ring, that nahi, we should get it checked, something might be wrong. Acha, let's say we ignore that step as well. So kya hua? After that, it starts in seeping into the nerve of our tooth, which is the heart of our tooth. And that's when it becomes super excruciating pain, where our children cannot bear the pain. They start having sleepless nights. They cannot eat. They start avoiding chewing and biting, because that side is so sore and tender to any kind of pressure, and they do not enjoy that kind of pain and sensation coming through. And eventually, as it starts getting infected, a pus boil starts forming, and which may appear on the red skin like that near the tooth. So, and then you'll see swelling, and our children cannot sleep. And then obviously we've reached to the stage where it is unbearable. So now if we see in this particular slide very clearly, first of all, if you see the first teeth structure is showing a healthy set of teeth. So this is a baby set of teeth, which is again 20 in number, 10 on the top, 10 in the bottom. And this is a healthy set of teeth, which is showing us that this is how a presentation of a healthy teeth should be. Now, अब थोड़ा सा mild decay हुआ, तो what is it that we want to see? Sometimes some parents come to me and they say, my children's teeth is very, very good. Come doctor, see, can you see these white frosty snowy patterns on their teeth? And I say, yes, I can see that. So they say, oh, they're whiter than the normal teeth that it's meant to be. But that is not true. That is actually a sign of demineralization. Demineralization का मतलब है कि because वो area इतना ज़्यादा sugary component से exposed है, brushing उधर सही नहीं हो रही है, जिसकी वजह से eventually the tooth structure is losing all its important mineral contents, and henceforth the first appearance that you see in the baby teeth is that white frosty snowy flaky pattern. So that is again should ring an alarm, should ring a bell for you that something is wrong. I need to act upon it. I need to start brushing well. I need to I'll talk much more detail about it in later slides. So this is where we need to get alert. Okay? And then eventually comes the presentation. So then we come to the level where we see the third slide, where we see the moderate cavities, and we see what happens is that white snowy flaky pattern, it starts breaking down. It appears as a yellow base, which is your second part of the tooth. And when it is furthermore ignored and not taken care, it turns into brown base, as you can see on the picture. And then eventually when it touches the nerve is the severe decay, or the fourth presentation where you see all that pussy pustules are forming, and you can see that the teeth have completely shed and broken, and they have touched the nerve. And this is where our child is in problem. Shall we move to the next slide, please? Okay, so now let me give you a little heads up what exactly is going on in the mouth. Now, usually with our children, we do a lot of bottle milk, and we need to understand that the bottle milk is very high in sugar. So number one, first of all, I'm using a nipple. So agar nipple ka suction, if I think in my mind, nipple ka suction kaisa hota hai? It's like, so when I'm sucking onto it, which area of my mouth is getting involved? So the more I'm sucking, these 4 teeth of my mouth are getting involved. And this is the common milk bottle presentation of a cavity. So when 4 of my teeth is getting involved, to kya ho raha hai? That sugared milk is just sitting on that part of the teeth throughout the night time. So then what is happening is the bacteria or the germs in our mouth are always there. So in the night when our child is constantly suckling onto the bottle or the mother's breast, the milk is sitting on the mouth over our teeth and forming a house for the germs and the bacteria. And then what happens is the sugar is converted into an acid, and that acid then creates the cavities to start and makes the structure of our baby teeth cookie crumbly in nature. I know everybody might be thinking, क्या दूध नहीं देना चाहिए बच्चे को? नहीं, of course देना चाहिए. That is the main nutrition our children will get, right? But then what are the tricks that we should do in order to have getting those teeth coming into cookie crumbly nature and deteriorating the quality of our teeth, right? So that is what we will talk as we move forwards. Okay, so I'll quickly go through this slide, which is just giving us a little heads up. What is a baby bottle tooth decay? So baby bottle tooth decay is when we're extensively drinking from the milk bottles and the milk is staying over our teeth throughout the night. So with the nipple suction and obviously with the sugary component and the bacteria's involvement, it is causing the teeth to deteriorate. And it may affect all the teeth, most commonly the front teeth, which I just spoke about. Then what is the period when we should think about giving up the baby bottles or the breastfeeding? So one thing that we need to bear in mind that 12 to 18 months, which is first birthday se leke 1.5 saal tak, is an ideal time to wean the child of night feedings. Because, and why I'm constantly saying night feeding is because daytime mein agar bacha doodh peeta hai, he has a lot of time where the child will talk, The child will move around. There's a lot of mouth activity going on, which is actually going to not allow bacteria to have such a high impact versus in the night. The child is suckling onto the bottle, drinking, and then dozing off. So henceforth, it is very, very important that koi bhi damage, anything which will start will actually take part after 15 months of age. So anything that we can protect, prevent, or wean between that span of 12 to 18 months would be ideal. And one thing that we need to bear in mind is after the child is done drinking the milk bottle or breastfeeding, I understand it is a very tiring process as a mother. I do understand. I am going to add one line that you need to take care of it, which is giving water to your child after that. Either you take a gauze in your hand, wet a gauze, and wipe the gum pads of the child with the water so that no traces of the milk remains in the mouth. Or if the child is at that age where you've introduced the solids and you've introduced the water, then you need to start using a bottle and have a little water post the milk, so the remnants of the milk or the particles of the milk does not remain in our mouth. Why does your child develop so why does your child develop baby bottle tooth decay? We've already spoken about it at a greater length. And what are the ways to prevent baby bottle tooth decay? That also, cleaning the gum pads nicely and giving water is what is ideally required. Okay, now we spoke about baby bottle, breastfeeding, and so forth, the cleanliness. Now in the children who are eating, who are taking their solids, eating anything and everything, so that mostly comprises the ages of 3 to 6 years, where they're having everything, solids and everything. So now again, I have a tooth structure, okay? My tooth is getting exposed to lot of yummy foods that my mama is making at home. So I have all that food sitting over my teeth, and that's where the bacteria will actually start lodging onto the teeth. And bacteria will start lodging onto the teeth. And aksar we must have noticed that the teeth gets that sticky yellow layer over our teeth. And we think, kya khana phasa hua hai, khana laga hua hai? No, it is not the food. It is actually the home of the bacteria, where all the germs are collecting and forming a sticky layer of bacteria in it. And again, it is going to go attach, and if it remains and if it is not brushed well and it is not cleansed out properly, then all that sweeties and all that yummy food which is sitting on our teeth, the bacteria is having a party in the night inside our mouth. And then it creates that acidic environment in our mouth, and henceforth, again, cavitation starts and we go back to zero as how we spoke about it earlier. Okay, so then that's when what happens is over the span of time, these cavities, these chocolates, these yummy foods make our teeth go in a very bad state, where the party has taken up into a position where our children are into suffering and excruciating pain is going on. So now we should be very mindful of what kind of diet that we're offering our child. See, I love chocolates. Okay, so I wouldn't say don't give chocolates. I wouldn't say you cannot eat meatha. No, you can, but everything in moderation is good. So now let's talk about good foods and bad foods. And I know we all know about it. So I wouldn't go further details into it, ki kya acha hai, kya bura hai, but I'll specifically mention certain things which we need to bear in our mind in our daily routine, which works as an ideal home remedy to help our children not have the major set of cavitations which they may have. So now when we come to good foods, we all know fruit, veggies, our proteins, our nuts, eggs, everything is a wonderful resource that we should be giving. Lekin, there's one thing that my child may say, I want to do snacking and I don't want to eat all this. Then what should I offer them? So then anything which will help curbing the effect of the bacterial invasion would be, number one, you can offer lots of yogurt. You can offer lots of cheese. You know how actually we can protect these cavities from happening in our mouth? We have saliva in our mouth. जो हमारे मुंह का पानी होता है, the saliva, it has lots of good bacteria and it has an environment which is alkaline in the environment. So जो acidic environment create होता है मुंह में, जो सारा damage cause करता है, वो saliva help करता है उस impact को curb करने के लिए. लेकिन there are such amazing food products that nature has provided us जो उस alkalinity को increase करने में and saliva की production को increase करने में it helps in our mouth. So what is that? So that is cheese. Cheese is a very good component that should be incorporated in between meals, in the snacks for our children in order to neutralize the acidic environment. Plain yogurts are again a very good source. A little higher age, black teas, green teas, those are kind of things which are help curbing the impact of the acidic environment in our mouth and helps protect the cavities in our mouth. And then again, nuts, dry fruits are the things which are also something very important, because as in, for example, something sticky or anything is sticking in our mouth, by eating those things, it washes out the because it's chewy and it's hard, so it takes away all the sticky bits in between the teeth and helps digesting it properly and reduce the acidic environment in our mouth. Now the bad guys like sweeties. Now let's talk about bad guys. So the bad food, we know what it is and we all know about it. Even if I don't go into the details of it, let me mention how would you compare a sticky candy to a chocolate? If you ask me, if I have to give a sticky candy to my child or a chocolate, I would rather choose a chocolate over a sticky candy, because number one, a lollipop or a gummy that I will take in my mouth will take much longer to suckle on, to chew, chaba chaba ke khatam karne mein, and it will stick around all over my teeth and cause it to stick in between the teeth as well, on the places where it is very difficult and challenging for my child to clean. And even as a parent, it's not an easy task. And we have our challenges with our kids as well. Some are very good with brushing and some would give us hard time. So we need to understand and mindful of what kind of sweeties are we offering our child. Okay? So I would rather have a chocolate. Why would I have a chocolate? It's because chocolate is something, number one, dark chocolate would be an ideal option. Number two, milk chocolate is also a good option, because when I'm eating the chocolate, I'm not taking that long to eat it. It will quickly, nicely melt inside my mouth and it will finish. It will still cause the acidic environment, but the level or the timing it stays in my mouth will be much lesser. And the impact of damage it will cause in my mouth will be much lesser compared to a sticky candy or a toffee or any kind of sweet milk, which stays all around our mouth. Like our kids love strawberry milks and banana milks and chocolate milks. Yes, you can give, but in moderation. Everything in moderation is good. So make a schedule, make a chart where I'm not saying no to these things, but something which is done balanced out, maybe twice in a week, ice cream once in a week, over lollies and over lollipops and over sticky candies, let's opt for chocolate, and that too twice in a week, right? And something like, if your child is, some children are very highly addicted towards having lollipops. And if so is the case, yes, there are healthy lollipops options available in the market, but then why should I go in that path if I can work towards weaning my child off it? Or you can do honey pops at home, make them your own honey pops, and that is something which you can offer once in a week. So these are the few things that you need to be mindful of. Secondly, lots and lots of water drinking is required. So my juices, I know some children are into drinking pops and colas as well, which is highly not advisable. This is something which would cause, so basically teeth is also a bone, right? So if we are, for example, do an experiment in your house. When your child loses a tooth, take a glass of cola, put the tooth inside it and leave it overnight. And in the morning, if you find the tooth inside it, very good. But I assure you, you wouldn't find the tooth inside it. Why? Because these are such harmful products that they dissolve the bones. Tooth is the hardest bone of our mouth, of our body. Okay. And if anything like a juice or cola can do that, then you can well understand how dangerous and how harmful it is to our rest of our body as well. Right? Secondly, apple juices, orange juices, pineapple juices, those are also highly acidic in nature. So all this will increase the impact. Henceforth, always, if you're giving it, dilute it in water or reduce the frequency, and be mindful as to how many times you're giving it. So you have to do your charting accordingly and reward your kids on it, so that accordingly they get that motivation coming through, that we're eating healthy versus bad. Right? And lots of water drinking after everything. Just like I said, milk ke baad pani pina zaruri hai. Similarly, for example, we're giving a Panadol to our child, we're giving a Tylenol to our child, or we're giving any kind of liquid multivitamin to our child. We need to understand that usme bhi sugar component hai. There is a high level of sugar in every medication that we administer to our child. So we need to bear in mind, giving water after that is very, very crucial. Some children may have asthma, they may be getting puffs and stuff like that. Always make sure you get them to rinse out their mouth. But if they're not at that stage where you can rinse them out, make sure you're cleaning the gums and teeth out properly. I'm going to talk about the brushing techniques. So brushing technique is something now which is very, very crucial and important for our little ones. And if done correctly with the right manner, then it helps and sort them out for future as well, because it's a good practice. Now, first of all, what we need to understand is when we have a baby between 0 to 3 years of age, and especially a baby, as you can see in the picture as well, there's a little brush which is called the finger brush. This is something which we can use to clean out the gum pads. So this is the finger brush which comes, it's like a silicone brush. And if you can see some digits at the back, which helps cleansing the tongue of the gum of the child as well, because after the milk and everything, all the milk tends to clog onto the tongue, so it helps cleaning that bit out. Or also this part can be helped massaging the gums of the teeth as well, and this soft bristle helps in cleaning the teeth of the children as well, so, or the gum pads. So this is what we're going to use, but we have to bear in mind that between the ages of 0 to 6 months, the child can only clean it with the help of water, or you can have a toothpaste which is fluoride free. So it could be an organic toothpaste or any toothpaste which has all the right components, which is going to help clean the gums out, but no fluoride, because as we understand that children are very delicate and sensitive at that point of time, and they're ingesting a lot of toothpaste and fluoride, which is not very healthy at that age and stage. But once they start eating their foods, at that point of time, we can start giving them fluoridated toothpaste, which is 6+ onwards. Now, what we need to do and how we need to do the brushing is, and we need to bear in mind, if, for example, we do not have this kind of brush and we cannot afford it, it's perfectly fine. What we need to do is take a gauze, wrap it around the finger, make it wet, and then go around the teeth and go around the gums and clean it. Take a little bit of toothpaste, which you're going to be applying onto the finger brush or the gauze, and you can massage the gums and brush it all around. And if the child has one tooth, does not mean you're just going to brush that tooth. You're going to do the rest of the mouth as well. All right. So the question is, how much toothpaste is required for children aged between 0 to 3 years? So again, 0 to 3 years. I just spoke about that a very small quantity is something which is required to clean the children's teeth, because we don't want them to ingest it, right? So the amount that is required to use for 0 to 3 years, ideal would be a rice grain size or a smear. Now the question would be, what is rice grain size or what is a smear? So as you can see over here, and I'll show it to you now. So what needs to be done is, so I have a toothpaste here. So I'm going to show it to you on my finger. So a rice grain size is something like this, okay? And a smear is something like this. Or else in the market, you have these brushes available, jiske andar you'll have these little marking done on your brush. So for example, agar ye mera bristle hai, these are my bristles. So I'll have a little marking of yellow or a little marking of green, showing me, indicating me that age group and the amount. And I just need to put utna, just that much in order to brush the teeth. So for 0 to 3 years, a rice grain or pea size is what is required. Then coming to the ages of 3 to 6 years is when we start using, so between 2 to 5, we use a pea size. So pea size is again a chota matar ka dana. So as you can see in the picture right over here, or it's about this much quantity. Okay? And then when we go above the ages of 5 and 6, then we can have a regular ribbon. We call it a ribbon size. Again, a little ribbon size is what we're going to use. And again, as I said, manufacturers have done such great job with the brushes nowadays. You'll get that little indicative bit on the brushes. Uske basis will be, it will be a good guiding factor for you guys. Okay, now coming to the fact, so we're going to talk about brushing now. So I've got this little thing over here with me with a little brush, and I'm going to talk about how do we need to brush our teeth properly, especially for kids aging between 2 and 6 years. So on and on, we've spoken about the babies, their brushing up till the 2 years, but Now the question is, how should I brush my baby's teeth, my child's teeth between 2 and 6 years? So this is how we're going to do it. Take a brush, okay, and make a song out of it, any song. I have a basic general गाना जो मैंने बनाया है, which I enjoy doing it. So now what I'm going to do is, whenever I have to brush my teeth, I have to bear in mind that I don't have to just focus on the teeth. My gums are as important to be brushed as my teeth are, because my gums is something which is holding on to my teeth. और अगर मेरे gums healthy नहीं होंगे, if my gums are not going to be healthy, my teeth is eventually going to get weaker in nature, and if so forth happens, I'm going to lose my teeth. That's why it is very, very important to massage your gums alongside your teeth and then have a little motion on your teeth. So for example, as you can see with this, I've got a brush and I'm going to go in, putting my bristles of my brush in between the gum and half of the tooth structure. So ये जो मेरे gum margins है, I'm going around that gum and the tooth. And then I'm going to go round and round. So I'm massaging my gums and half of my tooth. So anything, the food particles are very sticky and then they tend to lodge in between these gum margins. And it is very, very important to dislodge that from there. So when I put the brush in between the teeth around the gum margins and the tooth, I go round and round. So I'm not only massaging my gums, I'm also releasing that lodge food from in there. And then I'm going to go up and down, up and down. So I usually tell my kids to, whenever they're doing their brushing, to enjoy the brushing, what they do is go in between the gums and go round and round, up and down, round and round, up and down. And I tell the same for the parents as well, so they can make it into fun, enjoyable for their kids, because I know lots of parents face a lot of challenges brushing their children's teeth. So when they do it in a singing form, in a dancing form, or more of a family thing, then eventually it's a good practice instilled into your child. And then when you're doing the back teeth, which is again very, very crucial, so you have to take the brush, go at the back. These are your chewing surfaces and the in-betweens. So you go with your bristles, go round and round, round and round, and up and down, round and round, and then you go up and down. And that's why it is very, very important for you to do it for your child or with your child. So you always have to remember 2 times brushing is what is ideal. Number 1, in the mornings. Ideal would be after breakfast, because what you do is when you wake up, you do a rinse, you let them have the breakfast and do it. But I do understand that the challenges are there, that we have to rush off to the school and we do not have that kind of time and everything. And it's absolutely all right. Brush your teeth before breakfast, do a good rinsing, gargle, drink lots of water and rush off. In the evenings, now it is very, very crucial. Before going to bed, brushing is very, very important, because all that food that has lodged all over the day is sitting there, and if we don't brush it in the night, तो रात में हमारे bacteria party करेंगे हमारे mouth में, and that is what we don't want. So that's why night brushing becomes very, very crucial, and that's when I want parents to get involved much more. So what I want the parents to do is, let your child brush their teeth first, and then the last 10 seconds is what I ask for you to go inside their mouth, especially at the back areas, which normally tends to get ignored by our younger ones, and clean them out properly for them. Literally 10 counts. Our children do not have that kind of patience. Yes, 2 minutes is ideal for ages between 4 and 6 years. But if you can't manage, but if you can still manage a nice supervised or a little help brushing, and you can manage it, then teach your children that 20 seconds, 20 seconds, 20 seconds, 20 seconds, 20 seconds, and 20 seconds, and the last 10 to 20 seconds is what you're going to participate into doing it for them, so that they have a cleansed out mouth. Then they can rinse out and let that remain. So this is how the brushing needs to be done. Followed by brushing, another very important and crucial thing that we miss out is, we brush everything out, but most of the time children have very tight contacts, very, very tight contacts in between the teeth, and are not able to clean in between the teeth. There, one very important component that comes through, and this is very crucial for ages between 4 and 6 years, is we should start introducing a little floss. So this is what a floss would look like. We should start introducing a little floss. Now flossing is something, as you can see, a little string in my hand, and this is my tooth structure. So what am I going to do is, I'm going to go in between the teeth, okay? I'm going in between the teeth, and I'm going to go to and fro. So it needs to be gone in between the teeth. okay, in between the teeth, and to and fro, and then you come out. But you do not have to go with pressure. You do not have to go with pressurizing and touching the gums. You just need to gently enter the tooth structure, okay? And you need to go to and fro, attaching the walls and then coming out. So this is what it's meant to be done. And flossing is very, very important. So either this kind of a floss or something like a string, whichever is comfortable is what you need to do. So either the floss picks, which is like a little plastic pick with a string, or this. Everybody is different. Nothing is good or bad. It's all about comfort at the end of the day. Whatever makes you feel comfortable and you can do a better job with it. And flossing does not need to be done 2 times a day. It just needs to be done 1 time a day, every night before going to bed, post brushing. All right, so we've spoken about the brushing, we've spoken about the toothpaste, the amount that we need to use, and the flossing. Now, another thing and a very crucial important thing that we tend to ignore or miss out is some of our children have the habit of thumb sucking, and due to which we don't understand that there's such adverse effects which may be causing a lot of complication of our jaw and growth development in the longer run. As you can see in this slide very clearly that this girl is a thumb sucker and she's sucking onto it. But one thing which got missed out over here was that this girl's habit was not attempted to be weaned off at a good age. Now, when I say good age, what do I mean by good age? Thumb sucking to koi bhi kar sakta hai. They're born with it. And that comes naturally to most of the kids. Now, you just cannot go and do anything to their thumb, right? So we have to think about how can we wean it off and what would be an ideal age to do so. So always remember, at the age of 4 years, your permanent teeth starts to develop over your baby teeth. And that's when your structure starts to form for your permanent set of teeth. So it is very, very crucial and it is very, very important for you to bring that balance out, that between the ages of 3 and 4 years is when you should try working towards weaning your child of the habit. Ideally, sooner the better, because what happens is when child is at a tender age, it is very easy to get them off some habit. But as they grow older, they get more awareness. It's very, very tough and challenging for the child to leave their lovelies out. And obviously it's a thumb. We cannot cut it or we cannot do anything about it. So at the ages where we can wean them off. Right. Similarly, lot of the children are lot of children are mouth breathers. Can we have another slide, please? So a lot of the children are mouth breathers or they are into pacifiers. Most of the time, our parents keep giving children pacifiers up till the ages of 3 years. And then again, the understanding is what will happen? The structure of the teeth will not form properly. The top and bottom teeth will not meet properly. Eventually, our child will struggle with their speech because they will not have clear speech. There would be lisping. They won't be able to speak properly. Whenever they have the tongue twisters, they will have issues talking with that. And aesthetically also, the top and the bottom teeth does not meet. And that also causes thrusting. Now, at this stage where a child is a mouth breather, again, the growth and development will get affected. So here, what you need to bear in mind is, please check with your ENT for adenoids and tonsils. Because if your child has adenoids and tonsils, which is causing the blockage of the nose and allowing more natural oral breathing, then we have to get that part out ruled, because if the adenoids and that is sorted out at the earlier age, then eventually the child will start breathing through the nose properly. Otherwise, the mouth breathing will encourage more outgrowth of the teeth and again cause developmentally problems and delay with the entire growth process. And similarly with the pacifiers as well, we need to bear in mind that a cutoff is around 18 months to 2 years max. Beyond 2 years, we're going to encourage again the same kind of issues, because the roof of the mouth is very tender. Just like when a baby has the head and sutures, which is very tender, similarly the roof of the mouth is very tender. And any kind of external forces, which could be a thumb or pacifiers, can cause the jaws to take up the abnormal position and allow the teeth to grow in the wrong position and growth pattern. All right. So now, how to make a dental visit happy experience for our children? I understand every child is different. Every child has their own set of anxieties or inquisitiveness, which would make them think and understand that what should I be doing? So as a parent, it is our core responsibility that what we should do is whenever we're preparing our child for the dental visits, ideally it should be done when the child pops his first tooth out or when the child is 1 year old, to the maximum of 2.5 years as the first visit. Reason being that any practice which is acquired earlier with a positive mindset will eventually lead into a healthy practice and relax the child from future anxieties. Or whenever you're preparing your child for the visits, there are lovely books, as you can see on the screen, which you can read out to them. You can read, reading done to the children stimulates their mind, give them that vision, and they can vision and make up their own stories and get more positively ready for their visits. Or you can do some videos which are available over the YouTube and other places and prepare your child, and this could eventually lead into a positive experience for them. So the constant earlier visits will carry a healthy practice for them.
Thank you, Dr. Anila. We will open the floor to all our parents. You can use the Zoom chat to type in your questions, and we will, read it off for Dr. Anila, or you can unmute, raise your hand, and we will unmute you, and you can connect with her as well. I have a few questions that I noted down, so maybe I can begin, and then if we have any raised hands or more questions coming in the Zoom chat, I will read those off for you as well. A parent has shared that my 2-year-old is having tooth pain and is drooling much more than usual. What can I give to my child to reduce the saliva drooling and relieve the pain? Can you share some ideas for this parent?
Okay. So, so my question again, I wanted to understand is the tooth pain related to the teething? Is that what he's more focused on? Or is the tooth pain related to any kind of cavity or any kind of sensitivity the child has experienced? Because it could be either or. At 2 years, as I said, you will be sitting on 16 teeth inside your mouth. So, and again, as I said, an earlier and extensive exposure of milk bottles can lead earlier cavities as well, which could cause sensitivity to the teeth. So yes, any pain will encourage the saliva to increase, and drooling is very common to happen. So number one, if it is due to the teething that the child is having the sensitivity and drooling, then what we need to do is there are very good market homeopathy medicines that are available that they can use. Other than that, at home, they can use dry water or coconut oil that I had mentioned earlier as well to massage the gums. That will help soothing the area. They can also, it will soothe the area as well. And with the salivas as well, when they do these teething gels, which are available in the market, that is also help calm the salivary flow. So that is something, and lots of sipping of water will also help. A little warm water will help reducing the salivary flow.
Great, thank you, Dr. Anila. We have, this question has been very popular in the chat. It says, at what age should a child begin visiting a dentist?
Okay.
A couple of parents had asked this.
Sure. So, okay, now, as I said, ideally speaking, a child should be visiting a dentist as earlier as the first birthday. So between the span of 1 year to 16 months is when you should be visiting your dentist. Now, most of us are of the opinion that my child doesn't have anything. Why should I go and visit the dentist at that age? And again, fine, I understand. Why should you, right? So the thing is, then you have to bear in your mind that if not at that stage, because वो age इतनी crucial होती है that if anything has to develop, कुछ भी initially या early रहता है, the dentist can catch that for you, can do fluoride applications for your child, can guide you on your dietary habits and brushing habits to have a positive and a healthy go forwards. But let's say अगर हम वो नहीं भी करते, तो at the ages of 2 years, it becomes mandatory for us to go and visit the dentist, because at that given point of time, again, we're sitting on 16 teeth. We have a lot of, if there is anything with related to the gums, weak gums or teeth, the dentist will be able to guide you. Kuch na bhi ho, to bhi a positive, healthy visit for your child will keep that mindset for the future, because that will help child create a positive liking towards the dentist and the dental environment, that forbid sake tomorrow even a simple cavity that appears, that child will be confident enough to go and get the work done.
Wonderful. Thank you, Dr. Anila. Thank you, parents, for flooding the Zoom chat. It's always very nice to see the enthusiasm of asking questions and learning from the expert. We had more questions. There was, the advice that was recommended to reduce the amount of juice a child should intake. A parent has inquired if they can use a straw with juices so it doesn't harm the enamel. Your thoughts on this?
Yeah. So straw is a very good thing that you can use in the initial year. So it's very, very important that you start introducing a straw even when you're weaning your child off the bottle milk. Stop करने की ज़रूरत नहीं है. Child can have milk. Child can have that. But a straw is a very good form when you introduce to the child because it tends to go directly through the throat. Yes, a little bit of exposure. But again, what happens with the juice part is that juice has a very high citrusy things. And if you're giving a concentrated version of it, again, the constant exposure with the straw, yes, you're taking it, but little bit exposure is still happening, right? As I said, lollipop aap de sakte ho. You can give a healthy lollipop. But then again, anything done in moderation will help to prevent any kind of future problems. So I'm not saying that you cannot give juices, but anything diluted with water or done in low frequency, again, beautiful with the straw will help create much more healthy practice and reduce the chances of the high index of cavities.
Great, lovely. Thank you. Thank you, Dr. Anila. If there are any participants who would like to unmute themselves and talk to Dr. Anila directly, yes.
Hello.
Yeah,
Flavored milks at night.
what was that again? Sorry.
Kareem, can you please repeat that question of yours, please? Thank you. You're on mute. I'm going to unmute you so you can ask your question to Dr. Anila.
Loudly.
Yes. Yeah, Kareem.
Can I have flavored milks at night?
Can I have flavored milk at night?
Flavored milks and nights. Okay. When you say night, what do you mean by that? Is it just after your dinner or is it before your dinner, like a snack? How can you specify that for me, my love?
Before going to bed, I'm saying.
Before going to bed. Okay. Very good question, my love. Okay. So the thing is, ideally speaking, that first of all, let's avoid flavored milks in the night because they have a very high sugar component in it. Yes, if you wish to give milk to your child, go ahead. Cow's milk is ideal. But that you need to bear in mind is that even if you're giving your child cow's milk, make sure you have a bracket of 40 minutes between the milk and you're going to sleep. Reason being that the bacteria take around 40 minutes to neutralize the environment in your mouth. The saliva takes about that cycle of 40 minutes to neutralize the acidic environment in our mouth. So ideally, the safest option would be plain cow's milk without any added chocolates or strawberries or anything to it. Okay, but even if you're doing it, then it shouldn't be every night. It should be once or twice, making sure the teeth are rinsed out properly. I wouldn't recommend brushing immediately because by brushing immediately after a sugary drink or anything, you're allowing it to spread more onto the other sides of the teeth and the tongue, which it did not get exposed to. So ideally wait 40 minutes before you brush and then you go to bed. So whatever you do, it has to have a bracket of that 40 minutes. Alongside, ideal would be plain milk.
Building on the question, Dr. Anila, there is a parent that said cow milk can be given to children if they're 2 years as well. Like, is that okay?
Yes, it's perfectly fine for a child to start having cow's milk after the ages of 15 months. And it's very, very safe. See, again, I'll say every child is different. They have different needs for their bodies. My child may be very weak, needs lacking in the nutritions and everything. Then even if I have to give them a Pediasure milk or a formula milk, as per with my respective pediatrician's advice, I would still do so, making sure uske baad proper rinsing ho, 40 minutes ke baad brushing ho. That is the pattern or the cycle that I need to follow. But yes, for a 2-year-old, cow's milk, as long as there are no allergies associated with it, is ideal. And even if somebody has allergies associated with it, almond, coconut, soy, cashew milk, these are the ideal options.
Thank you, Dr. Anila. If there are more parents and family members who would like to talk to Dr. Anila, please let me know in the Zoom chat. I can unmute you or you can raise your hand and we can unmute you. But there have been coming, a lot of questions are already on the chat, so I'll just read one. There is a parent that says, my child is taking treatment for iron, which is giving discoloration. How to resolve the issue?
All right. And how old is the child, if I may know?
The parent hasn't mentioned, but maybe if the parent would like to unmute and speak to Dr. Anila, then we can help you unmute.
5 years. Okay. All right. So the child is 5 years old. Okay. Very good question. And I'm glad you picked it up. So yes, lots of children are lacking iron, and lots of our children have iron deficiencies, and they are on iron supplements. So now the thing is, iron, as we can see, is brown and black in color, and it is very, very easy for an iron staining to appear on the teeth. So what you need to do is, number one, what you need to do at home is, after the iron supplement is taken, so as I mentioned earlier as well, kisi kisam ki bhi multivitamin ho, and especially iron, make sure you make your child rinse the mouth immediately after that, okay? Or you make the child drink water after that. Reason being, that will reduce the components or the minerals sticking onto the teeth. So automatically the level of blackness that is showing on the teeth, wo usko kam kar dega, and it will not appear. It will still appear, but it will reduce to a greater extent. Secondly, what we need to remember is that brushing after doing the supplements in the span of 30 minutes is ideal, because that's also going to get the count of that iron remnants from the mouth. Thirdly, since your child is 5 years of age, अगर वो छोटी होती between 0 to 3 years, मैं ये नहीं कहती कि dentist के पास ले जाके cleaning करवाओ, but the main thing about the iron salts is it is very superficially on the tooth. Unfortunately, with a normal brushing, it does not come off. So yes, go visit your dentist. If your child is can manage the cleaning, get a cleaning done. What that will do is it will clean out all the teeth, and it will reduce that iron component for future reference. So the adherence of iron particles on the teeth will automatically reduce. Or the fourth trick that you can do at home is take a basic battery operated electric toothbrush, salt and water ka paste banao, okay, add it to your toothpaste, and then gently do it. That will also reduce the iron ka. Wouldn't take it away completely, but will help to a greater extent.
Okay, thank you, Dr. Anila. We can take one more last question. If any family member would like to raise their hand or give us a thumb reaction, we can unmute you, or you can unmute yourself and talk to Dr. Anila. We can take one more question. This parent is saying, my son has been through teeth removal after severe decay on the central incisor. Although he has never ever used a bottle for feeding, all we knew about the problem was he was known to be iron deficient. I wanted to know whether the removal of the teeth was normal and we should expect no complications at the age of his permanent tooth replacement.
Again, may I know how old is your child?
4 years old.
All right. Sounds good. All right. So basically what happens is, I'll give you an example over here. Now, many of the children have the teeth which are genetically weaker in nature. And it is very true that his iron levels must be low, and due to which it did not get that substantial push to get the teeth more stronger in order to suffice through the span of time. So what happens is that due to the iron deficiencies and due to other minerals as well. So you need to bear in mind, not just you and other parents as well, that introduce vitamin B12 in your child's diet, do calciums, do proper minerals and multivitamins, because what they do is they help reduce the mineralization of the teeth, demineralization of the teeth, and helps remineralizing the teeth. So now what happens is that yes, it must have gone to that stage, but then again, there are a lot of external factors. So number one, genetically, he must have gotten a weaker set of teeth, which contributes to 60% of the structure of the tooth. Secondly, 40% is your environmental factor, which could be your food, your dietary habits, your drinking habits, and everything which adds up to it. And the mineral, the mineral component, which is lower. So the combination of this can make the tooth structure very cookie crumbly in nature, and it's very easy for them to chip and break very easily and expose the nerve. And once it gets exposed to the nerve, then child may suffer a lot, and there are only two options then you're left with, either removal or doing a root canal for a baby tooth. Always bear in your mind, baby teeth is like a mother bearing a child in her. Baby teeth is the mother. Child is the permanent teeth, which is protected by the tooth. So if my mother is unwell, which is my baby tooth, then eventually my permanent teeth is going to come back. So that's why if I have to treat my baby tooth, which could be either a removal, which could be a filling, which could be a root canal, please go ahead and do it rightly with the due course of time, because you're indirectly protecting the child inside the gums, which is your permanent teeth. So I believe, I do not know the details, much details of the case, but as I hear it from you, it sounds right.
Great. Thank you, Dr. Anila. Thank you very much. Parents, I'm certain that we have learned and benefited from Dr. Anila's experience in dental care and her suggestions on following steps for proper hygiene for our children. Dr. Anila, on behalf of the entire SEEDS team, we thank you for joining us today and sharing your insights about healthy lifestyle and habits for our children. It was a pleasure hosting your webinar and listening to all the wonderful advices that you were able to provide our families.